So let's think about this problem. I want to talk about arguments in ethics. An argument is a set of claims in which some of the claims are given as reasons for believing another claim. We call the reasons premises. The claim that the reasons are supposed to support is called the conclusion. It is standard to write out arguments with a line above each conclusion. The line is called the line of inference, and we pronounce it therefore. Bob needs care. Bob refuses care. Therefore, Bob is doing something wrong. Is this a good argument? No, it's not a good argument. Why not? Well, the premises are about Bob and care, but the conclusion is about Bob and doing something wrong. The premises do not address right or wrong. They only address care. So ethics is about right and wrong, and arguments in bioethics have what we call normative conclusions. There are normative and non-normative claims. Normative claims are evaluative. So here is a claim that is not evaluative. It is raining today. It may be true, it may be false, but it is not evaluating anything. Here's another claim that's not evaluative. I dislike Brussels sprouts. This is true, but it's not an evaluation. Claims that offer no evaluation, that involve no values, we'll call non-normative. Now, other claims are not value neutral like those claims. Evaluative claims are normative. If I say, rainy days are beautiful, I'm not just talking about fact. I'm evaluating rainy days. If I say, Brussels sprouts are evil, I'm not just describing Brussels sprouts, I'm making a value claim about them. When we are doing ethics, we use normative claims. If you talk about what people think, this is sociology or psychology. Social science deals with facts. But in ethics, we're talking about the right thing to do. We're talking about the prescriptive, the evaluative. The terms on the left side of this slide are normative terms. Those on the right side are non-normative, are merely factual and descriptive. They're factual without a value component. There is a difference between what we can do and what we may do. Facts about what we can do are purely factual, while facts about what we may do are evaluative. Let's talk about Cinnabons. Let's look at each of these claims in turn. Cinnabons are sticky. Is this a normative or a non-normative claim? It's non-normative. It is simply a statement about the viscosity of Cinnabon icing. But what about Cinnabons are icky? This is a normative claim. It involves an evaluation of Cinnabons. It says something negative about them. It is illegal to steal Cinnabons. Is this a normative or non-normative claim? Non-normative. In this country, to help slaves run away from their owners was illegal, but that doesn't mean it was morally wrong. Questions about what is in the law are, from the point of view of ethics, non-normative. People who steal Cinnabons are bad people. Well, that's clearly normative. The word bad makes the evaluation involved pretty clear. People should not steal Cinnabons. Is this normative or non-normative? Well, it's normative. The word should is the clue here. All this talk about Cinnabons is making me hungry. Is this a normative or non-normative claim? It's non-normative. It's a simple fact that does not involve evaluation. Moral valences are like electromagnetic valences. A molecule can have a neutral charge, a positive charge, or a negative charge. And actions can have charges too. An action can be permissible. That means it's okay to do it. An action can be impermissible, meaning that it is not okay to do it. Or actions can be obligatory, where it is our duty, or we ought to, do that action. If an action is obligatory, it is not okay not to perform that action. We are responsible for doing it. And if we use that vocabulary for ethics, we can be a lot more clear and express ourselves much more precisely. Now let's think about addressing the ethical question, is it permissible for the healthcare professionals to let Bob leave the hospital? We must respect autonomous choices. It is Bob's autonomous choice to leave without treatment. Therefore, Bob's healthcare providers, abbreviated here to HCPs, are obligated to let Bob leave without treatment. That seems like a pretty good argument. The premises tell us about the healthcare provider's obligations, and everything seems to be connected pretty well. We can see how the premises support the conclusion. Next, I want to talk about fallacies. Fallacies are mistakes in reasoning. I want to talk about a particular fallacy. We call it the naturalistic fallacy. The naturalistic fallacy is a kind of mistake people make when reasoning, and it is made a lot. That's why we have a name for it. The naturalistic fallacy is committed when only non-normative premises are used to support a normative conclusion. Let's take a look at this example. Most people believe that it is permissible to steal office supplies from the workplace. A few pens here, a few paper clips there. Many people do steal office supplies from their workplaces. This is a bad argument, because you see two non-normative premises and a conclusion that is evaluative and therefore normative. The conclusion says that it is permissible to steal office supplies from the workplace. So this commits what we call the naturalistic fallacy. Let's look at another example. Mrs. Patient has a systemic infection. She's septic. Mrs. Patient's sepsis is curable using available antibiotics. Third premise, if Mrs. Patient doesn't get effective antibiotics soon, she will die. Therefore, Mrs. Patient's HCPs have an obligation to administer curative antibiotics to Mrs. Patient. Now, this is a bad argument. Do you see why? It may not be what she wants. Side effects of the antibiotics might kill her anyway. Maybe death is a better option because it is less painful. So there are a number of things that show us how the premises could be true and the conclusion false. A set of all non-normative premises do not do a good job of supporting a normative conclusion. Let's consider some more arguments using the concepts I have introduced. Healthcare professionals are obligated to act so as to improve the health of their patients. Well, this is a normative premise. Bob is Dr. Sanchez's patient. Well, I haven't introduced Dr. Sanchez before, but let's suppose that's true. It's also non-normative. The only way that Dr. Sanchez can improve Bob's health is to keep Bob from leaving the hospital. This is also a non-normative claim. It is a biomedical claim. It might be false, but that does not make it normative. Therefore, it is obligatory for Dr. Sanchez to keep Bob from leaving the hospital. This is a normative conclusion. Now let's consider, does the argument commit the naturalistic fallacy? No. The normativity in the first premise is enough to avoid that. Is it a good argument? It looks pretty good. We might want to investigate whether that last premise is true, but otherwise it doesn't seem bad at all. Let's consider this argument. Healthcare professionals are obligated to act so as to improve the health of their patients. Normative. Bob is Dr. Sanchez's patient. Non-normative. Therefore, it is permissible for Dr. Sanchez to keep Bob from leaving the hospital. That's normative. Now, is this a good argument? It is a little bit different from the previous one. For instance, the font is different, but it turns out that the font type and size rarely affect the truth or normativity of arguments. Another difference between this and the previous argument, that's more relevant, is that the conclusion here makes a claim about what is permissible, while the previous argument defended a claim about what is obligatory. This by itself does not make the argument bad. In general, we accept that if you have an obligation, then the action has to be permissible. We can't be obligated to do something that we are not allowed to do. But note that we have one fewer premise than in the previous version. Before we have this statement, the only way that Dr. Sanchez can improve Bob's health is to keep Bob from leaving the hospital. When we take this out, it is a much weaker argument because, well, maybe there are other ways to improve Bob's health that don't involve keeping him in the hospital. Now, what about this next argument? If Bob does not have a cabbage very soon, he will probably die from his condition in the next few months. Bob knows that if he does not have a cabbage very soon, he will probably die from his condition in the next few months. Therefore, Bob ought to consent to a cabbage. What about that? The premises are both non-normative, but the conclusion is normative. It does commit the naturalistic fallacy. It's a bad argument. Here's another one. Human beings have a natural instinct to preserve their own lives. Bob knows that if he does not have a cabbage very soon, he will probably die from his condition in the next few months. Therefore, Bob ought to consent to a cabbage. What about this argument? Is the first premise normative or not? Well, that's interesting because it brings up the question of whether natural is good. We usually believe that natural is good. That's why we have natural foods. And we have a tendency to connect artificial with bad. However, unless this is made explicit, unless the argument includes the claim that what is natural is good, this first premise is not normative. Even if this premise is true, that does not in itself tell us that we ought to follow our natural instincts. The argument commits the naturalistic fallacy. Let's talk about just one more argument. If Bob does not have a cabbage very soon, he will probably die from his condition in the next few months. The available healthcare teams will not perform a cabbage when a competent patient refuses to consent. Bob will not consent to a cabbage. Therefore, Bob will not receive a cabbage. Does this commit the naturalistic fallacy? It does not. Why? Because the conclusion is not a value conclusion. It's not normative. The argument is interesting, but it is not about ethics. And some of you will note that the premises also don't have a claim about whether Bob is competent. So it may not be the strongest argument, even though it does not commit the naturalistic fallacy. The last thing I want to talk about concerns the broad basis for this whole approach, what I introduced as a philosophical approach to bioethics. Why is it that arguments are important? Why do we need to give reasons for claims about what we think is right and wrong? Many people will tell you that there is no true or false in ethics, or that ethics is about how we feel about things. I've already said that feelings are important, and I mean that. But there can be many people involved in an ethics case, and they won't all have the same values or the same background. One wants to know what Jesus would do, another wants to know how to minimize pain or the financial impact of the patient's care. So how do you figure it out? What do you do? There are many clinical settings where religious traditions inform or even dictate practice. And that's fine, but it's not the type of setting most of you are preparing to work in. So we need a way to deliberate that goes across traditions. What do we all have in common? Well, we have reason, we have logic. The practice of giving reasons for our positions is a powerful way to bridge differences, and the claim that a particular action is required or prohibited by a given religion is an important claim, one that needs to be taken very seriously. Note also that such claims are non-normative. They need the help of a normative claim if they are to support a normative conclusion. We all have feelings. If I claim to be angry, this is either true or it's false. That is, either I am angry or I am not angry. But feelings themselves are neither true nor false. Thus feelings cannot by themselves do the job of serving as premises to support ethical claims. If you and I feel differently about some matter, this may tell us a lot, but we do not have a way to determine whose feelings ought to direct our actions. If all we have are feelings, then what will happen is that the person with the most power will end up getting her way. Telling this person that you are uncomfortable with the decision will not go very far unless you can give reasons for thinking and not just feeling that your position is better.